Anyway, just for people's information, I was called to a press conference with the Health Minister of Ontario, Dr. Eric Hoskins, and the very good news was that the province has agreed to fund $450,000 worth of staff for us. That will mean 4.5 people to implement our drug overdose plan. They will also be funding 80,000 Naloxone kits for the province of Ontario, and a good number of them will go to the City of Toronto, of course. And within that, the public health units across Ontario have been designated as the institution that will be managing the Naloxone distributions in their jurisdictions. So that's a good thing as well. So I think frankly, the province has done some good listening on the issue of drug overdose and the harms that come from that, of course, and the deaths that have come from that. And they have responded very well with a plan and also with a good amount of money. So that's. And the people who clapped the loudest actually deserve to be clapped for, because they provided the impetus and the encouragement to keep us on the straight and narrow. So right back at you, back there. Yeah.
Zoe Dodd was there and said, "Be careful what you wish for." Zoe Dodd is the founder of Moss Park Overdose Prevention Site, which gives rescue breathing, oxygen, no chest compressions. Because Zoe's saving non-drug overdoses and drug overdoses, teaching people to give rescue breathing. June 12th, press conference at Toronto Public Health's head office. Chest compressions only. More chest compressions only. No rescue breathing. January 9th, 2017, Mayor here, John Tory, with the Associate Medical Officer of Health for the province of Ontario, Dr. Barbara Yaffe, said it's rescue breathing. John Tory's quoted, "This is what causes people to lose their lives," quite literally. Yep, non-drug overdoses and drug overdoses, because the signs of drug overdose can mimic any of the hundreds of causes of breathing emergency. And if you've got a breathing emergency, chest compressions and deny rescue breathing is murder on both counts. For some reason, millions of you are following this mass murderer's instructions. Dr. Eric Hoskins, MD. Far left here, that's Joe Cressy, the new chair of the Board of Health, who tells me to shut up and cuts my microphone while making deputations at the Board of Health. He knows I'm trying to save his life and his family member's life, and it's illegal to tell someone to shut up and cut their mic. You have 5 minutes to speak.
Was the CEO of the Canadian Helen Keller Society, and I just feel sorry for the people that cause themselves needless death and deafness and blindness. There's this deal's issue with the funding for HIV and harm reduction and child youth resiliency. So we need a lot more funding for harm reduction, HIV prevention, etc., and children resiliency. But Toronto Public Health has spent a lot of money on a program that's costing you a fortune. Public Health has just started 25 training sessions that are going up around this city. They have a capacity for 1,200 people. It's the Naloxone program. They are not distributing Naloxone at these events, but they're teaching all people all the signs and symptoms of respiratory emergency. Then chest compressions is included. As Dr. Davila just mentioned, eating cannabis causes you to go into respiratory failure if you get a large dose of edibles. So, I'm just trying to save lives. That's a no-brainer. There's over 1 million people taken to the hospital per year with a respiratory emergency. They need respiratory assist. Anyway, you guys have a great one. And I hope Mr. Hoskins, you got him straightened out.
Dr. Hoskins, are you a fan of Jack Nicholson, the actor? Yes, Gary. There's a movie out called A Few Good Men. Jack played a Colonel Jessup. There was an issue about a code red military term for intruder. This code red caused the death of a soldier. Doctor, in medical terms, what's code red mean? Well, Gary, that would be a heart attack or a cardiac arrest. And Doctor, code blue in the medical terms, what would that mean? Well, that would be a breathing emergency, which there's hundreds of causes. Dr. Hoskins, you've heard of Dr. Joseph Mengele, otherwise known as the Angel of Death. In the camps, they used hydrogen cyanide. What's the treatment for hydrogen cyanide poisoning? Well, like most poisonings or drug overdose, Gary, it's oxygen, rescue breathing, and antidote. Thank you, Doctor. Doctor, you've heard of the Heart and Stroke Foundation. Yes, they have a chair on the resuscitation guidelines, which come out every 5 years. And you know the statement from the Heart and Stroke Foundation on chest compressions only? That it's for a layperson never trained for a sudden witnessed cardiac arrest? Yes, and that's a very, very rare event, isn't it, Doctor? Oh, to be sure, to witness a cardiac arrest. Okay. Dr. Laurie Morrison here. She was co-author of the 2010 resuscitation guidelines on toxic ingestions. Her recommendation is start with rescue breathing, give Naloxone, continue rescue breathing. Dr. Hoskins, there was a coroner's inquest. A man named Sean Court. He was your director of policy when you were the Minister of Health, Ontario. Under questioning, his response, asked about rescue breathing, was, I don't know, I don't know, I don't know. I want my lawyers. Go ask Eric Hoskins. St. John Ambulance, the Canadian Red Cross, and the Heart and Stroke Foundation have always said rescue breathing is of primary importance to anyone suffering any breathing emergencies. Not chest compressions to people who are alive. Dr. Hoskins, I'm wondering, how many people have you taught the person's comatose, labored, shallow breathing, or not breathing, turning blue from lack of oxygen, making gurgling noises, pinpoint pupils, then instruct an eye rescue breathing, and give chest compressions only. Millions, Gary, millions. Doctor, did you order the code red? You're damn right I did. Eric Hoskins is probably a Freemason. January 2021, a priest of the Freemasons got a hold of me. He says, Gary, it's not a good idea to teach millions of people how to kill Freemasons, is it? Oh, a brain cell. Read the comment box for the medical information.